This video is about hydrochlorothiazide, nifedipine, side effects, and what you can take naturally to not take this medicine, at least what I would do. So, starting with, what is nifedipine prescribed for? Nifedipine is prescribed to treat high blood pressure and to control angina, which is chest pain. It's a type of, it says right there. Okay, so for blood pressure, nifedipine is given. Nifedipine, being unnatural, has side effects. What side effects are smaller in comparison to the benefits of taking the medicine, right? So says the doctor. Serious side effects may occur. Bloating, swelling of the face, arms, hands, lower legs, or feet is considered a serious side effect. They say it's common. It's quite common. But why does that happen? It can also cause fast, irregular pounding or racing heartbeat when it's to actually control the blood pressure. So that's odd. Blood pressure is directly associated with how the heart beats, right? Chest pain, which is angina. It says it's supposed to help that. Causes chest. Okay, I thought that was failure. There it is. So also, this can cause congestive heart failure. It can cause myocardial infarction, which is heart attack. Palpitations, which is a quick, fast fluttering of the heart. There's the chest pain, which that's one of the reasons it was actually prescribed. It can cause low blood pressure. It can cause a fast heartbeat. Here, there's cardiac arrest. There's more layman terms of heart attack. Arrhythmia, saying that the rhythm is off. Okay, so I wouldn't take this. And later on, I'm going to show some natural foods that can be taken to help with blood pressure. So doesn't really have much of food interactions. It does have an interaction with alcohol. Multivitamins with minerals. Using nifedipine together with multivitamin with minerals can decrease the effects of nifedipine. Talk with your doctor before using nifedipine and multivitamin with minerals together. Doctors, they give drugs all the time, and they won't tell you this. Nifedipine, food. Okay, so it says grapefruit and grapefruit juice. Do not take it if you're taking nifedipine. Hydrochlorothiazide. Okay, so hydrochlorothiazide is a water pill which is given to the patient. It said it can help with blood pressure, but it's usually given to the patient to control the swelling of the legs that the nifedipine or other drug has caused. So it's a Ponzi scheme that the doctor with these medications is taking the person in the circle, and the doctor has no plan to get the person off of this medication because they just keep giving them medication and they're going around with the side effects. Side effects from hydrochlorothiazide: confusion. That's a side effect of many. It's one of many. Swelling of the face, fingers, legs, ankles, feet, or lower legs. This is what it's supposed to prevent. All medications is a there's a catch-22. Everything that is supposed to help, it also hurts or risk hurting. Another thing caused by hydrochlorothiazide is hypokalemia, which hypokalemia is low potassium. Potassium is an important electrolyte for heart function. Potassium is beneficial. You definitely got to have a balance of potassium in the body for balance of the heart, blood pressure. Potassium is crucial to the way your body functions. For starters, it acts as an electrolyte, which means that it carries an electrical charge. In this case, a positive one. There are different types of electrolytes, and each perform a different function in your body, like balances the fluid in your cells, contracts muscles, including the heart muscle, transmits nerve signals to your brain. Okay? Hydrochlorothiazide can cause hypotension. It may cause increased serum cholesterol and triglycerides, resulting in increased risk of cholesterol gallstone formation. So this drug can increase cholesterol, and you may be put on a cholesterol lowering medication like a statin, atorvastatin, one of those statins to lower the cholesterol. When you got on this tube for the swelling, which it causes swelling of the legs. Also, the nifedipine causes the swelling of the legs, which is a symptom of congestive heart failure, when the heart fails to pump the blood because it's not getting electrical charge from the potassium, which the hydrochlorothiazide is causing the potassium to be low. So this is potassium chloride, different from what you get naturally from food. This is something the doctor might prescribe for having low potassium. And again, potassium is needed for the heart to be functioning properly. Only going to go over some of these side effects, not a whole lot of them. Trying to get those that mainly pertain to swelling, heart-related, pressure. So, hold on. One, can I pass it? So because this potassium chloride is not natural, now a person, this accumulates in the body, and then the person is subject to hyperkalemia, which is an excessive amount of potassium, of this unnatural potassium, and that brings side effects. Hives, itching, red, swollen, blistered skin. Not really going to go off it, just wanted to say that. Signs of high potassium level, like a heartbeat that does not feel normal, change in thinking clearly and with logic. Change in thinking clear. Okay, got it. Feeling weak, lightheaded, or dizzy. Feel like passing out. Numbness or tingling. Slow heartbeat. See, because now the potassium's not in balance, right? Chest pain. So all three of these, I'm going to count this as a medication. It's a drug. The potassium chloride, to get the potassium level normal, causes chest pain. And it can cause the heart rate to be off, out of balance. So does the medication for the blood pressure, nifedipine. And I believe the hydrochlorothiazide did the same thing as well, as far as the blood pressure being out of balance. Actually, yeah, it does, because it causes the low potassium. Now, see that right there? There's Potassium pill, this fake potassium, can also cause the heart to be out of balance, and it can cause heart attack. See? Now, let's get to foods that can help, that your doctor won't tell you to get. So these foods, go to the top here. Foods high in potassium to look for when grocery shopping. I'm going to repeat this part. Potassium is a mineral your body needs to help your nerves, muscles, kidneys, and heart function well. A potassium-rich diet can offer many health benefits, such as lowering blood pressure, lessening the risk of kidney stone, and regulating blood sugar level. So we all know that bananas are good for blood pressure, or I'm sorry, for potassium. But the amount of bananas that we need to get the within range of what's recommended daily, you probably need about 11 bananas if you're getting it potassium solely from 451. I think more than that. Anyhow, I'm gonna show some more foods here. Leafy greens, Swiss chard. 1 cup of cooked Swiss chard provides 20% of your daily value, which is 961. So 961 times 5 is about what we need. I'll pull that up. Let's do that now. Adult males, it says they need 3,400 milligrams of potassium a day, and adult females, 2,600 milligrams of potassium per day. Pregnant people, pregnant women, 2,900 milligrams. Breastfeeding women, 2,800 milligrams. And it says U.S. Food and Drug Administration advises adults get no more than 4,700. We'll leave that there. So we're looking between, so for women, 2,600, non-pregnant women, 2,600 milligrams. All right, here's another chart on potassium. And I like this range a little better because it still tops it out at the max, the same max where it says FDA said no more than this in a day, and it made it higher here. Okay, so at 3,500 milligrams, how many bananas would a person need a day? What an adult woman need a day? 3,500. So there's 451 milligrams in a banana. 35. Okay, if I can type. 3,500 milligrams daily divided by 451 per banana equals 7.7. So you need, if using only bananas, you need about 8 bananas a day to get the potassium. But there's more foods, and should go over that list a little. Back to the list. So 961, if you're eating cooked Swiss chard. So 961 per cup. 3,500 divided by 961. A little more than 3.5 cups. That's a lot of chard, but hey, almost 8 bananas is a lot of banana. So mix the foods up. All right. Avocado, potato. I'm not a big fan of potatoes. I love potatoes, but they're starch, and a better option, healthier option is sweet potato, which has 542 milligrams of potassium. That's a medium sweet potato. Okay. Butternut squash, a cup of that has 582. So then again, just do the math, how much you would need. Just calculate these and incorporate these foods into your diet. That's what I would do. I'm no doctor, so I cannot give medical advice, but this is what I would do. Not a big fan of beets. So when you use you're consuming fruit, consume only fruit. For like within a 2-hour period. Don't mix fruit and vegetables together. You risk being quite gassy. Okay. Pomegranate, guava, durian, yams. You can do a search for the foods that you eat. You know, I typed in food time potassium and I got all of these. I'm not getting into the chicken and beef. That's on you if you eat that. If you decide on dried fruit, definitely get it without sugar because there's going to be a great deal of sugar in the dried fruit anyway. And I think that's it for this video. So I got clicked over here. Yeah, that's it. Hopefully this video was informational and helpful to you. With love, peace.